Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. And today we're going to talk about strep throat. If a child has been diagnosed with strep throat, more than likely they've had a few symptoms. Maybe a sore throat, maybe a fever, maybe belly pain, maybe rash, or a combination of all of them, or just a few of them. It's very important to know that you cannot diagnose strep throat just by looking at the throat. Your throat may look terrible and red and yucky, but it could be viral. Strep, on the other hand, is bacterial, which a good thing with that is because it's a bacterial infection, it responds to antibiotics, usually a penicillin-based antibiotic that you'll take for 10 days, and it will also make you feel better very quickly. Within 24 to 48 hours, you're going to feel like you're perfect, that there's nothing else wrong with you, and you may want to think about stopping the antibiotic, but you do not want to do that because the reason that we treat strep throat isn't just for the sore throat, the fever, the symptoms now, but the problems that it can cause in the future. Strep throat can cause something called rheumatic fever, which is an inflammation of your heart that causes extreme fatigue. The patients that I've had present with it will get shortness of breath even on standing up and going to the bathroom. It is not something that is subtle. The other thing that can happen with strep throat is glomerulonephritis, inflammation of your kidneys. So if at any point your urine turns very, very dark, you need to be seen immediately. Strep throat can also cause scarlet fever, which is a rash. It's red, raised bumps that feel like sandpaper. If you get that, you are actually more infectious and you should stay home from school for more than just one day. Usually with strep throat, I recommend an antibiotic for 24 hours and then you can return to school. But you can give this infection to your family and friends. Never share saliva with them in their food or drinks, and be careful about putting your fingers in your mouth and then putting them on surfaces because that's the way you share this infection with others. The other recommendation is a new toothbrush in 3 days. In order to prevent recurrent strep throat, you want to brush your teeth, keep your fingers out of your mouth, and you may want to consider doing an antibacterial mouthwash on a regular basis since you're exposed to this infection frequently. If you have any questions, if your child gets worse, they're not improving after 2 to 3 days, they should be seen in the office immediately. And if you have recurrent strep throats, every month or so you're getting sore throats or you start to snore severely after strep throat, then it could be a sign that your tonsils are getting too big and you could maybe need to see an ear, nose, and throat specialist.